Hello everyone, my name is Ivy Liu. I'm the registered dietitian at the Toronto Western Hospital Bariatric Surgery program. In this module, we'll be talking about protein after bariatric surgery. As you may know, protein is a very important nutrient for everybody, but particularly for bariatric patients. Protein is used in the body to build and retain muscle, to keep our immune system strong, and it plays a role in so many of the body's important processes. As you may remember, our end goal is to get as much protein from food as possible rather than depending on protein supplements. We'll talk about different sources of protein in food and how to know if it's time to transition away from protein shakes and supplements. For folks in the bariatric program, our overall goal is minimum 60 to 80 grams per day. The only way that we can know whether you're reaching this goal is to track our food intake. Fortunately, there are many great online tools to help with this. For example, Verytastic app or MyFitnessPal app. Each of these free services can be found on the web or on your phone's app store. Now, if apps and websites aren't for you, we still want to do our best to track our protein. To do this, it's important to read food labels, take notes or estimates of the protein content each time you eat. This can be recorded in a notebook, on your phone, or wherever you want. If you're using this method, another great tool is found in your nutrition manual, where we have a list of high protein foods and how much protein they contain. This can be helpful for products that don't typically have food labels, like meats and such. Regardless of the method or what tools you use, we want to add up our daily protein, aiming for 60 to 80 grams total. If you're reaching this goal with food alone, then congratulations, you have overcome a big hurdle here. At this point, it's okay to get off of the protein supplements and protein shakes. Now, to review some food sources of protein, we'll start with the most obvious sources. These include meats like beef and pork, poultry like chicken and turkey, seafood and fish, and eggs. Remember that some of these tough texture meat can be difficult to tolerate at 1 month post-surgery. So cut it in small pieces and utilize moist cooking methods such as braising, boiling, stewing, crock pot as much as you can. Dairy foods that have particular high protein are Oikos Triple Zero Greek yogurt, Skyr Icelandic style yogurt, cottage cheese, milk, cheese. For yogurt in particular, keep an eye on added sugar. Remember, we want foods with less than 10 grams of sugar per serving to avoid dumping syndrome. If you are having a lot of trouble digesting meat protein or animal-based protein, I do encourage you to try vegetarian sources of protein. I know many of us may not be familiar with these foods, but plant-based proteins offer the advantage of being very easy to digest, which is particularly important for bariatric patients, especially if you're having trouble tolerating meat. Foods like tofu, edamame, tempeh, textured vegetable protein, centei, veggie beef rounds, and soy milk are great sources of protein that can really help you during this time. I encourage you all to push outside of your comfort zone and try some of these foods. You can find a list of recipe websites and books at the back of your nutrition manual. You can try bariatricfoodie.com to learn recipes from folks who also had bariatric surgery. Other plant-based protein sources are beans, legumes, nuts, and seeds. Some examples of beans and legumes include kidney beans, chickpeas, and lentils, which are all high in protein and fiber. You can also start to try nuts and seeds at around 6 weeks after surgery. Just be very careful of portions here because nuts and seeds are what we call calorie dense. This means that even as little as 1 cup can be 900 plus calories, which can push us past our calorie limit without knowing it. This is why we recommend limiting your portions to the inside of the palm of your hand or to a maximum of 1/4 cup. There are also a couple of high protein milks are available on the market. These can be a helpful stepping stone when transitioning from protein supplements to solid protein foods. Some examples are the Fairlife, Joya, Natural Plus milks. These products are made by essentially taking apart the different components of milk and reassembling them in a way making the protein content higher and the sugar content lower. There's also a couple of high-protein plant-based milks, Ripple, which offers 8 grams of protein, and Milk Enjoy, which is an unsweetened almond milk with 8 grams of protein. These can be found in the grocery stores or online, and they can be a great alternative for those who find protein supplements too sweet or too thick. There's also a protein water called Protein 2.0 that some folks prefer over traditional protein shakes. Another great alternative is Revolution Fruit Splash, a protein powder that resembles juice more than thick protein shakes. Yet another one is the plant-based protein shake brand Good Protein that offers some unique flavors such as orange cream pop, chocolate mint, banana cream, as well as unsweetened flavor. These alternatives can be found online for delivery or at supplement stores like Popeyes and GNC. This is an example of what eating may look like on the soft diet while meeting your goal of 60 to 80 grams of protein per day. In the morning, if you want to have a cereal that has some good protein and fiber, I would recommend the Cashew Go Lean along with half to 1 cup of milk. Then have 1 protein shake in the morning, followed by half to 1 cup of chili at lunchtime. Then 3 pieces of marble toast with cheese or hummus as an afternoon snack. At dinner, have half to 1 cup of chicken stew. Then have Greek yogurt for your evening snack. A meal pattern similar to this will help ensure that you're meeting your protein needs. Take note of the fact that there are high protein foods at every meal and snack. This is very important. If you find that you're getting really tired of the shakes and are still struggling to meet your protein needs from food alone, you can start to try protein bars. The trick here is to make sure that we aren't just getting a chocolate bar with some added protein, meaning that we don't want bars that are really high in calories, sugar, and fat, as this can put you at higher risk of dumping syndrome. In order to avoid doing that, we have set out some criteria for choosing protein bars. You're going to receive a protein bar handout as part of your 1-month class package. This handout can also be found on our website at TWH Bariatric Clinic. In general, we want to make sure that all bars have less than 250 calories, less than 10 grams of sugar, and at least 14 grams of protein. Just to give you a few examples here, the pure protein bar is the most commonly found one and one of the most affordable one. The Quest protein bar and Kirkland protein bar are high in fiber, which can be helpful if you are constipated and need to incorporate more fiber. The Quest protein chips is a nice alternative to offer a different texture. You would have received a protein bar handout as part of your 1-month class package, and you can refer to that handout for more information. This is the end of the protein module. I shall see you in the next one.